Today we're going to talk about thiamine deficiency, and the reason why I chose to do an entire video on just one vitamin is because thiamine deficiency is something that can really cause a lot of problems that can be permanent with bariatric surgery patients, and it's something that can easily be prevented. Even if your doctor or the ER physician that you see doesn't quite suspect it at the beginning, just being a patient and being aware of it is incredibly important. And you can actually prevent a lot of problems long term if you know a little bit about thiamine. So, hi, I'm Dr. Reed Berger, and I'm an obesity medicine physician. And what I do with my channel is I like to talk about a lot of patient-focused things that can come up, issues that can come up, and I really like to do my videos based on what my patients discuss with me. And so lately, we've been having a lot of patients that have been diagnosed with thiamine deficiency. So I'm going to talk about that a little bit today. So what is thiamine? Thiamine is vitamin B1, and it's really essentially in all multivitamins. So a lot of times, and I brought this up in previous videos about vitamins, is patients will say, "Oh, I get this in my diet and that kind of thing," and they don't realize that in order to prevent long-term problems from bariatric surgery, you have to take your vitamins. So just taking a multivitamin with just 1 to 2 milligrams of thiamine in it is enough to be able to prevent any kind of problems in the long run. But the thing is that the body stores of thiamine are only good for about 4 to 6 weeks. So if you're not taking your vitamins, then as you can see, when problems arise after surgery, even within just 4 to 6 weeks, you can develop a deficiency and the body gets depleted of thiamine very easily. And then needing to replace the thiamine would be in doses of 100 milligrams parenterally, which means IV or intramuscular. So we need a ton of thiamine in order to treat thiamine deficiency, but to prevent it, all we need is a multivitamin. So thiamine deficiency is usually in patients, usually within the first 6 months of bariatric surgery, because it could be anywhere from 2 years, and it can be as early as 4 weeks after surgery. As I had mentioned, taking your vitamins is incredibly important, and you can see why you can get a thiamine deficiency so soon after surgery because the stores are so quickly depleted. Because there's only about 4 to 6 weeks of stores of thiamine. And easiest way, just take your multivitamin, and that's the best way you can prevent it. So, and I want to just look at my notes, make sure. Yeah. So, why do we get it? So in most cases, and this is what I always tell my patients, is you have to be aware that whenever you have any kind of GI problems, particularly vomiting, that is when patients are most at risk for thiamine deficiency, and that's where they get depleted. So if you're coming into the emergency room and you come in with vomiting, a lot of times the emergency medicine physician is going to be so focused on why is this patient vomiting after bariatric surgery. But what you as a patient have to be aware of is to be like, I'm a bariatric surgery patient, I need thiamine. Just say the words thiamine, and that's like the most important thing you can do as a patient. So thiamine needs to be given. Thiamine is, I'm going to say thiamine so many times, like just get used to it in this video. But thiamine basically needs to be given. It's important in glucose metabolism. It's important in carbohydrates, fats, and amino acids. But what you have to remember is that when glucose is given to a patient, it actually speeds up the depletion of thiamine because thiamine is needed to deplete or to metabolize glucose. Okay, and I don't want to get too technical, but again, if they're seeing that a lot of times if you're at the doctor and they're seeing that you've been vomiting, they want to figure out why has this patient been vomiting and then how can we treat it. So a lot of times they'll give fluids, but if they give fluids with glucose, that can actually make the thiamine deficiency worse. Now, what do you look out for in terms of symptoms? Symptoms, we talk about CAN. So CAN, C-A-N, and that's what we learn in medical school. So it's confusion, any kind of weird mental, a lot of patients feel like they kind of have memory issues. That kind of thing is what they first notice. Ataxia is the A. Ataxia means like an unsteady gait. So they may just complain that they're unable to walk. I mean, it could just be something as, as I can't say simple, but something like that, or non-specific. And then nystagmus. Nystagmus is just an abnormal eye movement that us as doctors can see on the patient. Sometimes the patient can see it themselves, but a lot of times patients complain of blurry vision. So that would be their main complaint. And it can also, as it progresses, thiamine deficiency can lead to neuropathy. So my main complaints that I've seen with our patients is that they complain of the blurry vision, they complain of confusion, and they complain of numbness and tingling and weakness in their legs. So those are the things you want to worry about and get treated immediately. So this is something that needs to be addressed immediately, because those things can go on to become permanent. Okay. And the main thing that you can do is get to a doctor, say the word thiamine, and also just try and take as much thiamine as you can just over the counter until you're seen appropriately. So that could be, maybe taking a B complex instead of your multivitamin if you're unable to take anything down. And then what is let's see, so we talked about why, and then again, why does this happen? I mean, it just happens over time. When a patient has bariatric surgery, maybe they haven't been taking their vitamins, now they can't tolerate things, they just had surgery, so there's a decreased intake of vitamins, some intolerances, and the weight loss all make people prone to getting the deficiency. And then I mentioned just the physiology and when it can occur, as soon as 4 weeks after surgery up to 18 months. And the main thing to remember is it's a clinical diagnosis. So meaning that no labs have to be done, no testing needs to be done. You have a patient that comes in, you are a patient that comes in with this history, and this needs to be suspected and treated, because there's no harm to treating this deficiency. There's no harm to treating it, but there's a ton of harm to not recognizing it and not treating it. Yes, you can get blood levels, you can get MRIs of the brain. Those are all things that are basically used for the diagnosis after the treatment has started. But treatment with IV or intramuscular, so in the vein or in the muscle, those things, not just by mouth. By mouth, once it's progressed, by mouth thiamine is not enough. It's fine after like 7 days of treatment. If everything is stable and symptoms have improved, then obviously you're going to go home and you're going to continue the thiamine by mouth. But in the meantime, it has to be treated by IV or IM thiamine. And the things to remember that later on, you can get a blood level to make sure that along with symptoms getting better, that the blood levels are improving. But blood levels are not always the best, again, because I had mentioned that the stores are low, in the body. So blood levels are not always the best. So there's a few tests, and those tests a lot of times require a send out. So meaning you're not going to get the level back for a week or so anyway. If symptoms have really gotten worse, the patient needs to be admitted, and a lot of times they do have to have a neurological consult and an MRI of their brain, because you can actually see changes in the brain with thiamine deficiency. And I'm not going to get into that so much. Today's video is more on like recognizing and just, hoping that we can halt this, because it has become a lot more prevalent in the past years. And I think that is due to thiamine deficiencies. So IV thiamine, IM thiamine are not deficiencies. I'm so used to saying that. Thiamine shortages a lot of times. So that's why, it's not given right away in the emergency room. What else did I want to go over? So the diagnosis is clinical, as I had mentioned, and the main things just, to look out for would be any kind of confusion or blurry vision or any kind of unsteady gait. Those are the things as a patient, numbness and tingling in the legs. Those are the things as a patient that you want to be aware of. And to always mention that T word to any provider before you get any kind of treatment, just thiamine before any kind of treatment. And the management, the prognosis of it, meaning, how do patients do long-term? If it's treated early and recognized early, a lot of times the abnormal eye movements, the abnormal gait, and all these things do resolve with time. The problem is when it goes to a more, so all of these symptoms I'm talking about, this whole syndrome, you might have also heard of it as being Wernicke's encephalopathy, that then goes to something called Korsakoff syndrome or Korsakoff psychosis. And that can lead to coma and death and permanent mental issues if untreated. So that's what we worry about. We worry about the permanent disabilities. So yeah, I just wanted to bring that up to everybody. And again, comment below if you've ever experienced any of these things or any other vitamin deficiencies that you want me to discuss, or really anything that you want me to discuss with bariatric surgery, both before and after. Like, comment, subscribe. Thank you so much for watching. I appreciate every one of you subscribing. I think, a few days ago I was at like 50 subscribers. Now I'm at 52. So every person counts, and I'm very excited about that. So yeah, just remember, thiamine can easily be treated. We just need to recognize it and be an advocate for yourself as a patient, and get that treated as soon as you can. So thanks so much for watching, and I'll see you next week.